from Riverview Animal Clinic. We're going to talk today about some common toxins exposures that we see, especially some of the seasonal things that are associated with springtime. The last topic we want to talk about is not really a seasonal issue, but in our practice it's becoming probably more common, and that is the accidental ingestion of human prescription or over-the-counter drugs. Usually the most common thing we see is someone leaves a pill bottle on the end table, on the coffee table, bedside table, someplace where the dog can get to it, and they'll pull the bottle down and chew it up. And the problem is you generally don't know how many of the tablets they've ingested, and it's a real problem with the whole class of drugs. We've seen it with anticonvulsants, we've seen it with ADHD type medicines like Adderall. We've seen other sedatives or compounds along those lines, and even some of the over-the-counter products have significant toxicities. All of the non-steroidal anti-inflammatories for people, ibuprofen, naproxen, all have potential for severe toxicities, especially in cats. Cats in general are more sensitive to most drugs than dogs are. Dogs are a little more tolerant, so doses that a dog even would tolerate are sometimes really severely toxic to cats. Acetaminophen is toxic. Not only does it potentially cause liver failure, especially in cats, but it also damages the hemoglobin in the blood and won't allow the hemoglobin to provide oxygen to the tissue, so you have loss of oxygen to the tissues and tissue damage that way, as well as direct toxic effect to the liver. We also have seen instances where cats, a couple of small tablets were dropped on the floor and the cat grabbed them before the owner can pick it up. That's probably a more common way for cats to get exposed. And again, one of those things where you have to be conscious about where you put them and where you leave them. And preventing exposure to begin with is certainly the best way to handle that.